Hello everyone, I am here to discuss on the topic general physical examination. So before starting the general physical examination, there are some prerequisites to be followed for any physical examination. The patient should be in comfortable position and the examination should be performed in quiet area and noise-free area. And before starting any clinical examination, always stand on the right side of the patient and always take the consent from the patient whether you are okay with the examination or not.
Yes, I am.
Okay. So may I proceed with my examination?
Yes.
Okay. Most of the time, the patient is very offensive about the examination. So always explain or assure the patient about the need and significance of examination. And examination should be done in proper sunlight because skin changes are more appreciated in the natural light area. Now there are 6 important things that are covered under the general physical examination are pallor, icterus, Sinosis, clubbing, lymphadenopathy, and edema. So I am proceeding with the pallor examination. Pallor is defined as the paleness of skin. It is due to the reduced amount of hemoglobin content in the blood or reduced amount of blood or in the anemic condition. Basically, the pallor examination is to rule out the anemia. So for pallor examination, the site is lower palpebral conjunctiva, and for this I will instruct my patient to look upward. चश्मा बता दीजिए ऊपर देखिए and the patient is looking upward, and now I will retract on the lower eyelid and see that there is any paleness of skin or it's a tissue in the eye of patient. Now I will instruct my patient to protrude his tongue. जीभ बाहर निकालिए. Okay. Now I will ask my patient to give his palm. There is no pallor is observing in his palm. Now I will observe the patient's nail. Okay, thank you. Now we will move on to the next examination known as icterus. Icterus is defined as the yellowish discoloration of the skin, tissue, and body fluid. It is due to the deposition of bile pigment, and the cause of icterus is increase in serum bilirubin level. Normally, the serum bilirubin level is 0.2 milligram deciliter to 0.8 milligram deciliter. When it reaches more than 2 milligram per deciliter, then it is the indicative of jaundice. And in jaundice, we will see the yellowish discoloration. And the site for the icterus examination is conjunctiva. Now I will instruct my patient to look downward, and I will retract up the upper eyelid and see for any yellowish discoloration. So my patient is not suffering with jaundice, so there is no yellowish discoloration observed in the sclera. Now I will look on to the nail bed of the patient. There is no yellowish discoloration found in the nail bed. Okay, thank you. Now we will move on to the next examination called cyanosis. Cyanosis is defined as the bluish discoloration of skin or mucous membrane. It is because of the increase in reduced hemoglobin content in the blood, more than 5 gram per deciliter. Basically, there are 2 types of cyanosis, peripheral cyanosis and the central cyanosis. Peripheral cyanosis are seen in the dependent part of the body, and the central cyanosis is seen in the central part of the body. So the site for peripheral cyanosis is the nail bed and the earlobe. And for the central cyanosis, we will observe the tip of the nose and lips and the tongue. So there is no cyanosis observed in the patient. So thank you. Okay, now we will move on to the next examination called clubbing. Clubbing is defined as the bulbous enlargement of the soft part of nail bed. So for examination of clubbing, we will observe the nails of the patient. There are some tests which are mentioned to rule out the clubbing. That is nail bed fluctuation test and the angle between the nail bed and the adjacent skin. So we will see the angle between the nail bed and the adjacent skin. Normally there will be the obtuse angle seen in normal patient. When there is obliteration in the angle, then it tells about the clubbing. Now there is one more test for rule out the clubbing, that is second mode sign. For this, we will instruct the patient to bring their both fingers approximately, दोनों finger पास में. इन सबको बंद कर. Now we will see if there will be any space present between the fingers, then it will be the normal condition. Then it is the indicative of that there is no clubbing present in the patient. And when there is obliteration in the space, then it is the confirmative test of clubbing. Now we will move on to the next examination, that is edema. Edema is defined as the swelling of skin or subcutaneous tissue because of the excessive accumulation of fluid in the interstitial space. So for the examination of edema, we will instruct the patient to make his leg upward. And now we will apply the pressure above the medial malleolus and see for and we will apply the pressure for 20 seconds. And we will see that any pit is present or not. So there is no pit observed in the patient. So it is the non-confirmative of edema. Now the edema is of 4 types. That is pitting edema, non-pitting edema, localized edema, and the generalized edema. Now the four causes of pitting edema is congestive cardiac failure, liver pathology, that is hepatitis and cirrhosis of liver, anemic condition, and it is seen in the renal cause also. And for the cause of non-pitting edema is myxedema and the hypothyroidism. Now the question arises how to differentiate 4 types of pitting edema. If the cause is congestive cardiac failure, then the edema is observed in the dependent part of the body, and along with that the patient comes with the complaint of dyspnea. In the renal cause of edema, puffiness of face and eye is observed in the patient, and in anemic condition, the edema is generalized, and in cirrhosis of liver, ascites is seen. Thank you.